Welcome, everyone, to the Lyfebulb seminar focused on cancer and supportive care. This is focused on cancer, but it entails so many other chronic illnesses as well, because the specific issue that we're talking about today is how muscles are affected by illness, by nausea, by all the consequences of treatment, as well as the diseases that we live with as chronic illness patients. My name is Karin Hienberger. I'm the CEO of Lyfebulb, and I am myself a patient as well as a trained physician. But my specific illnesses include kidney disease and organ transplant. And I have to say this specific topic is very dear to my heart, because when I went through my surgeries, I noticed very quickly that I lost muscle mass. So in medical terms, that's called cachexia or muscle wasting. And we have with us today two experts coming from different fields. We have a patient, Sophia Rossini, who's a community manager and patient advocate for Lyfebulb, as well as Dr. Jessica Scott, who is an exercise physiologist and has a very interesting background training and managing astronauts, as well as patients, and now with Memorial Sloan Kettering. So thank you both for spending time with us today. Perhaps, Sophia, if you want to say a few words about your experience with cancer, as well as your experience in particular with this condition, muscle wasting or cachexia.
Yeah. So my name is Sophia Rossini. I am a community manager for Cancer Life, as well as a patient. I am a non-Hodgkins lymphoma survivor. I've been in remission for about 18 months now. And I experienced some extreme muscle loss during and then after treatment. And that was really unique to me as a blood cancer patient as well, because I was already so sick by the time I started treatment that it was sort of an exponential decline for me, because I had already lost a lot of my strength at the beginning of treatment. So I was sort of set up to fail in a way. So it's been a hard time playing catch up.
It's a really good point that you could start at a point because of the disease and because of the treatment, and then it just continues. And I think that's what we want to talk about today. So Dr. Scott, a little bit about your background and your passion for this topic.
Yeah, I think it's such a great topic because muscle wasting is a whole body syndrome, and it's so important to try and prevent that and mitigate the loss. And I became interested in extreme conditions, and one of the most extreme conditions is spaceflight. So astronauts, when they go into space, they have about 2 liters of fluid that moves from the lower body to the chest and the head. And that obviously causes a lot of changes in the body, but one of the most impactful systems is muscle. And that's because in space, there are no activities of daily living. So astronauts move around by using their arms mostly. So they lose a lot of their leg muscle mass when they're in space, and they have a lot of challenges when they come back down to Earth. So what we did and what we studied was exercise interventions while astronauts were on the International Space Station to try and prevent those losses. And what we noticed with several colleagues is that patients receiving treatment, just like Sophia mentioned, is that there's a lot of muscle loss as well, but exercise is not standard of care if you've been diagnosed with cancer or any other syndromes like, if you've had a transplant, you may not be prescribed an exercise intervention. So that's what our group looks at, is how can we start to incorporate exercise training to offset a lot of the side effects of cancer treatments, either before, during, or after treatment.
So, when you say exercise, for me, being a former athlete, very competitive athlete, when I say exercise, I think, running fast, doing interval training, doing strength, playing some sort of competitive sport. But exercise in itself, I mean, how would you define it? What is exercise? I think it's important to set the parameters.
Yeah, usually we think of exercise as something that would increase your heart rate. So
Mhm.
exercise consists of either aerobic exercise training, so that's typically cardiovascular, where you go for a walk or a run, or there is resistance exercise, and that's more lifting weights or doing body weight type exercises. So you can do either one of those, which are very helpful for the systems that are impacted when you're receiving treatment. And it doesn't really matter if you're an athlete or you've never exercised in your life. It's never too late to start exercising, is what a lot of our work has shown.
That's great. So Sophia, when you went through your treatment and you noticed that you were starting to lose muscle mass, did you get guidance, or did you think about it yourself, or how did you react to it?
So I was super fortunate when I was first diagnosed. I was set up with a huge team of doctors for all different things. So one of the doctors that I saw was a nutritionist, and I feel like people have a lot of preconceived notions about what a nutritionist does, and is this gonna be sort of like a diet related negative connotation thing? But what she said to me was the most important thing you can do during cancer treatment is keep the weight on.
Mm.
And so she emphasized that anything that you are able to put into your body, please eat it any hour of the day. Anything that sounds good. She was like, I don't care if you go out and get McDonald's every day. Like, I would rather, like, fed is best. Um, and so that ends up being a key component to, obviously, to keeping and retaining your current muscle mass, but also because sometimes when you lean too far into the eating, then the combination of that plus the water retention from the steroids keeps your weight at a pretty consistent level, but you're not noticing that now all of a sudden that's not muscle mass anymore, and that's water weight, and you go to stand up one day and your legs give out, and it really sneaks up on you because you're not noticing any fluctuations in the scale.
That's a really, really important point. And it could also be that you're adding fat, right? So Dr. Scott, how do you analyze this? Because I'm sure you have metrics for looking at, the journey with the patient over time, whether they gain water, whether they gain fat or muscle, and losing, of course, the respective portions as well.
Yeah, that's such a great point. And Sophia, you outlined it so nicely, is that's exactly what you see is there's a lot of muscle loss, but you may gain fat mass. And so your overall body weight doesn't change. And that's a really important point because when you lose muscle, that's what impacts your activities of daily living. So walking up a flight of stairs or standing up from a chair, it's really important to try and maintain that muscle mass and not just maintain your weight. So there are some advanced techniques that we use. So usually patients will get a CT scan to look at where their cancer is. We can, in that CT scan, we can measure muscle and fat mass and quantify it very accurately, but there are much more low-tech ways, like a lot of the scales nowadays, they can give you your fat content, muscle content, and water content. And we use the scales in some of our trials to monitor those changes. And hopefully we're maintaining muscle mass and not seeing those changes in body composition that usually that's what happens when you receive treatment.
Yeah. The other point, which I think is important, is that so in cancer, in transplant, in other diseases where there's a surgical component or there's an in-hospital component, there's often a lot of attention in the hospital. Like I remember when I had my kidney transplant in April, at the end of the stay in the hospital, there was a person coming in assessing my ability to walk up the stairs. So, I've been in the hospital for 4 days. I kind of almost ran up the stairs. I felt great because I was on steroids too. So I was happy. But then I got home, and after a week or two, I noticed the weight loss, which was the muscle loss. And I think if they tested me then, it would have been more difficult, paradoxically, compared to, post-op. So, and I don't know, Sophia, if you have this experience, there's a little bit of a intense moment during that treatment, but then over time, when you actually lose the muscle often, less attention to the patient.
Absolutely, yes. I have been blown away by the standard of care that I received when I was in active treatment. I had a different specialist every day of the week to see, and I had not just one emergency number to call, I had 5, and I had nurses' cell phone numbers, and one of my oncologists gave me her cell phone number and told me to call her on evenings and weekends. And it's like I was so connected, and I felt like I really had a community of support. And then as soon as I was declared remission, then all of a sudden I had nothing. And it was sort of like, good luck, like our job is done. And I really had this intense panic moment of, now what? And who is my call when I have a concerning symptom, or who can I talk to that has expertise to get me back on track? Because it's not something that I could have achieved without professional intervention.
That is so powerful, Sophia. I mean, I don't know if it resonates with our listeners. It resonates tremendously with me. And I do think that that's the case for a lot of people. I don't know, Dr. Scott, how do you think that you're handling that in your, practice and also just in general? Unfortunately, that's probably what medical care is about. It's a lot about the acute setting.
Yeah, I think that is a huge gap right now in healthcare. Is there is a big push, rightly so, to focus on curing the cancer. That's the immediate concern. But we call it the survivorship setting, once you finish treatment, there is a huge gap in survivorship care. So there's a lot of research that is being done right now to try and address a lot of those gaps that Sophia and you identified of, okay, I've gone through this really incredibly tough period in my life. Now what? What should I be doing? What nutrition should I be taking? What exercise should I be doing? Again, what if I have these symptoms? So there's a push here at Memorial Sloan Kettering to have a survivorship clinic so that patients can come in and call if they have questions, and every year they can see someone and ask about those types of questions. But it is a big gap in the field right now, and there's a big push for research in that area.
That's good that there is at least an identification of the unmet need. It is maybe our role, Sophia, to kind of push for it to actually happen. And through Cancer Life and Transplant Life, at least patients can come together and learn from one another. But I do think that having real programs and having those phone numbers that we used to have, I also had a lot of phone numbers, at some point. Now when I call those numbers, I don't get a call back. So it's quite different. And unfortunately, it has to do with metrics, right? How is the center measured? What are the most critical patients? Who should we focus on? Because there are many. But building programs that take care of patients over time, because that's what we're all looking for, right? We're looking for healthy lives after we have put in all this effort to save lives. It's not just about surviving, but it's about thriving. So, yeah. From your perspective, Sophia, and then the same thing for you, Dr. Scott, what are some simple, exercises that worked for you and, getting you going again? Because when you are weak, you can't just go running. Then you may actually hurt yourself. You hurt your knees, you hurt your hips, and then you are back, below scratch. So what are some simple things you can start doing when your muscles aren't fully there yet? Sophia,
so the most critical one for me, it sounds so simple, but it was walking.
Yeah.
And it was something that I had to consciously incorporate back into my daily routine. Yep. Because suddenly when I didn't need to be sleeping 18 hours a day and I was up and ready to start moving around again, then I was realizing that I had absolutely no stamina even to walk to the living room and back or something small. So that was a very intentional choice by me to be extremely patient with myself, because at first it was something small, like 20 feet without getting short of breath or feeling dizzy. and really staying committed even when the results were sort of invisible for the first 5 or 6 months. Like I really didn't feel like I was getting any return on my investment. So trusting the process, and I think that having a more concrete survivorship program would help a lot more people stick
How
to
did you
the
stay
process.
motivated? How did you stay motivated? 5, 6 months, a lot of time without seeing progress. And did you have a buddy or, friend you did it with? Did you have some sort of little reward? I mean, for me, it's all about rewards. If I do this, I get that. And it's a lot about buddy, I remember for me after my transplant, I walked with my donor, like was my sister. We pushed each other. But did you have any special, tricks?
Yeah, my most valuable resource has absolutely been other patients in the community that have gone through it. So instead of like having my list of doctors' numbers that I call, I now have a list of cancer survivor friends that I will go to because we all have sort of different areas of expertise. So I always felt that if I had a question, somebody in the patient community had an answer. So I would regularly check in with a couple of my cancer survivor friends who were sort of farther along in their survivorship place than me. And they were really the ones that would give me realistic advice and say, like, I know that it feels like you will never be able to walk again. Like, I know it feels like you're starting from absolutely nothing, but you're going to get there. Like, I am living proof that you're going to get there. And so having that sort of tangible example was the most important motivator to me.
That's great.
That was something that doctors couldn't offer me. Like, that's something that I had to see to believe.
Yep. Any advice from you, Dr. Scott, both when it comes to what kind of movements or what kind of programs to implement without getting hurt? And then secondly, how do you motivate yourself, when you don't have someone like you telling them what to do,
Yeah, those are such important points that you both brought up. And one of those is when you're receiving treatment or if you've been in the hospital setting, that's when those big declines happen. So if you're not exercising during that period, there's different places where you're starting. You're starting at the lowest end and you're working your way back up. So one of the areas that we're trying to push is, when you're receiving that treatment, to exercise and then continue that in the post-treatment setting so that you don't get as low as you would if you're just, you're just getting through treatment, you're resting and taking it easy. But regardless of where the time point that you're starting, you mentioned you don't want to start off running. Not everyone needs to start off doing, an hour run or going for even a 30-minute run. It all depends on what your current level is. And Sophia, that's so impressive how you started is you just started, it could be as much as walking up a flight of stairs. That's your exercise for the day. And you really need to be aware of what your current level is. So you don't want to think, oh, my friend is already doing, 5 30-minute sessions a week. That's what I should be doing. What is your current level at? And a good way to look at that is we all have smartphones or watches, and you can see how many steps you're doing in a day. So if you're doing, 500 steps a day because you're feeling terrible, you want to start at that level and gradually increase. You don't want to go from 500 steps up to 10,000 steps, which everyone seems to want to target. That's a big leap, and that should take 6 months to get up to that level. And like Sophia said, it felt like it took 4 or 6 months to get to that point. That's how long it takes. And that's okay. You can just go slowly and gradually increase so that you don't get those injuries that you may get if you try to do too much too soon.
Yeah. No, that makes sense. It does take time. Anything that you can tell us, Dr. Scott, about what is happening in the muscles? I mean, why do we lose the muscles? I mean, are they being broken down? What goes on in muscle wasting?
There's a couple of different factors, and we call it a multiple hit. So there's several factors that may impact what's causing muscle loss. So one of those are the tumors themselves. So
Mhm.
one thought is that they release factors that target, your leg muscles, sometimes even your heart muscles. So that's one factor. The second factor are the therapies themselves. So things like chemotherapy is so great and wonderful at targeting the tumors, but it's a systemic therapy, so it goes everywhere in your body. So it impacts your muscles, your gut, your heart, all of those different areas. And the third area, which might be the most impactful area, is we call it an indirect hit. So when you're receiving chemotherapy or you're in the hospital, you don't feel great, so you become less active.
Yeah.
And we know that when you're less active, that's the quickest decline, the quickest accelerator for muscle loss. So all of those factors together, that's what causes that acceleration in muscle loss or muscle wasting or changes in body composition.
Yeah, and it seems to me that the loss of muscle and the build of muscle are directly related to happiness. At least for me, if I start building muscle, and meaning doing more exercise and walking, like Sophia, I did the same. Walking is the best, and using your smart phone or watch, whatever you have, to see you're getting a few steps in, a little bit more every day, or at least maintaining. You start feeling happier, and when you're happier, you may do more, and so it's true that I guess exercise yields endorphins, and that's another point for doing this.
Yeah, that's a great point. We're seeing it's a circle. So the more you're active, you can continue that activity. And if you're in a phase where it's really hard to be active, it's easier and easier to stay inactive. So that's why it's really important. Even just a little bit every day makes a really big difference.
So we've talked a lot, and Sophia, you didn't have any issues with your legs, or you of course lost muscle, but you could still work your muscles, meaning you could walk. But there are people who may not be able to walk. Maybe they have knee issues, hip issues, it may be stuck in a wheelchair or with a cane. What kind of exercises do you recommend to people like that?
That's another great point, is that you need to accommodate what your current level is. So walking, we know, is a great intervention, but for those who can't walk, there are other upper body exercises. So there's arm ergometers, where you can go to a gym and do cycling with your arms.
Mhm.
There are a lot of home-based programs where you do upper body exercises, swimming. It's really about what can get your body moving and get your heart rate up, is what we're finding is one of the most important factors to maintain muscle. So again, it's really about what you can do and what you enjoy doing as well.
Mm-hmm. Great. Sophia, any other recommendations of things beyond walking that you've done, or that got you moving the days when it may be raining? Or I remember there was a day in May or April, whatever, when I was recovering, it was pouring outside, and I started like walking in the house and lifting books and doing whatever you could do just to get that blood pumping a little bit. Got to be creative.
One of the most critical factors for me was being patient with myself and also not taking myself too seriously. So I love what you said about pacing in the house, because that was absolutely something I did. Through the long Minnesota winters, and I would just laugh at myself, and I would put on some music and I would try to dance a little bit. And it was so critical to hold on to little individual pieces of myself. Because that's really what ultimately motivated me to do the exercises in the first place, is that it really is that positive cycle of, as soon as you start getting some strength back, then you feel happier and your quality of life goes up, and the quality of life makes you want to do more. And it just ends up being sort of, in the same way it can be a negative cycle, it can be an infinitely positive cycle. But that's a conscious choice that you make every day.
Totally with you. And Dr. Scott, I think that's something, again, with the patients, right? And it's even maybe what you're wearing.
Yeah.
Like when you decide to do your exercise that day, you're gonna change into something. You're not just gonna wear whatever you were wearing, but you're gonna, like I said, this is my moment where I'm gonna take the time and get it done. And maybe when you come back from your exercise, you kind of give yourself a nice little, whatever you like, to reward yourself.
Yeah, I think the other important thing is, you have good days and bad days. Everyone has good days and bad days, and it's okay to have a bad day or multiple bad days, and it's okay just to start where you started. It's 2 steps forward, 1 step back, and eventually you'll get to where you want to be.
Yeah. The other thing that I think exercise affects, and I'm not sure if it's scientifically valid, is sleep. If you don't exercise and if you don't get your muscles moving, your heart rate up, it's more difficult to sleep. Is that just an old wives' tale, or is that something true to that?
There's actually a lot of evidence showing that physical activity and other interventions are really helpful for sleep, which is also really important for your quality of life and how you feel on your day-to-day basis, your mental health. So it is a circle on exercise being really important for your entire well-being, your whole body.
Yep. That's what I noticed. To sleep best when you have been active. Okay, so anything else? What would you recommend if you're in this moment now? You've been released from the hospital, you're cancer free, at least in the first stage of it. Of course, there's a period of intense monitoring. Are there any apps, any programs you recommend for patients to just get on? Buddy programs. I mean, Sophia, you said you found it through social media, found it through Cancer Life. Anything that you could give advice to our audience so that they can get started.
Yeah, I love what Sophia did and found a peer buddy. And you with your donor is finding that other person to interact with is so important for especially starting and then continuing early on. There are official programs available. So there's programs like Live Strong at the YMCA. And that's where you can go see a professional who's trained in working with patients with a history of cancer, and they know some specific exercise interventions that can be done, and they work with individual patients. But if you don't have one of those areas nearby, the peer-to-peer system is I think the most wonderful way to go.
Yep. Great. Well, Sophia, you already said that's how you reached out, and how you, I guess, stay motivated, right? And now you're a motivator for others. I mean, I guess that may be the final portion here, because we're coming to a close. How can people reach you, Sophia? Because you are someone who is motivating people. Are you willing to give out your Insta handle or your Cancer Life, and so people can connect with you? Because I think that is the best advice, finding a peer to connect with. And then I'd like to ask the same question of you, Dr. Scott. If you're in the New York area, of course, Memorial Sloan Kettering is a place to go.
Yeah, absolutely. That's been a huge motivator for me throughout, is to get to a point where I would be able to pay it forward and help other people that were in the same position as me. So absolutely. My Instagram handle is my first name, Sophia, my last name, Rossini. My Cancer Life, I think I'm just under the same name.
Yeah.
But either way, you can search my first and last name. I'm pretty ubiquitous on social media. I'm on TikTok, Instagram most often. You can also reach me by email. Anytime. Yeah, I encourage any cancer patient to reach out to me anytime. My DMs are always open. I'm always happy to help or even just listen and be validated.
Thank you, Sophia. And the same goes for me. If you want to reach out to me, I'm Karin Lyfebulb on Instagram, and obviously available as well on both Cancer Life with a Y and Transplant Life with a Y. And then finally, Dr. Scott.
Yeah, I'm at Memorial Sloan Kettering Cancer Center, and I'm always happy to talk about exercise training or any exercise interventions. Our group runs clinical trials for patients before, during, and after treatment. But again, I'm always happy to speak with anybody about how to start an exercise program or how to continue.
Thank you. Thank you both so much, and everyone a happy Friday, and have a good weekend. Thank you. Bye-bye now.